Pledge allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Minutes of the regular commission meeting held October 3rd, 2022. Motion by Hamry, seconded by Robbins. Any discussion? No discussion? All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Nothing under public hearings for tonight. Visitors and delegation. Well, first thing on the agenda is we have 3 city employees that will be recognized for their service to the community. And as I call you forward, please come up.
Jim.
Could have used the hospital.
Have we still got you there, Pierce?
Officer
Okay, all right.
John Michelson, please come forward. Dennis Strong and Officer Susan Schwab, please come forward.
Congratulations, John. The Reaper.
How many years of service, man?
I'll get there. It's my privilege to recognize these 3 employees for their service to the community of Devil's Lake. Officer John Michelson for 5 years of service. Congratulations. Thank you for your service. Dennis Strong, equipment operator for Public Ways. Thank you so much. And I remember in the day we worked together a long time ago, right? And Susan, 35 years. Officer Schwab, thank you for your service and dedication. Thank you. Kids all around.
Thanks, John.
Picked up my feet this time. Okay. Next on the agenda, Lisa from the Lake Region Heritage Center, please come forward and recognize yourself and speak loudly so we can hear you.
Hi, Lisa Crosby from the Lake Region Heritage Center. And I was going to come with 2 things tonight, but sadly we did not get the Main Street initiative, the Artists on Main grant. So I won't bother you with that. I'll come back with something else later when I think more about that. But for this last quarter, so this is for our 4th quarter funds, we have been really, really busy with not so much foot traffic. Once school starts, that slows down a little bit, but we have enough in the building to keep us very busy. So roof, as you guys know, I can't even remember when I had that bid come in, but it came in at $820,000 to repair the roof. That's a lot of money. So we're still, our board, we're still working and seeing how we can make that more achievable. And in the meantime, we did have it repaired. The rubber part and the drains repaired on the top, and haven't had much rain, but we did have a little bit and there was no leaking. So we are keeping the tarps on the courtroom until we have a significant rain or something to make sure it's holding. But he did a lot of work up there, and I'm hoping for the best for that. So other than that, we have a lot of meetings going on, people renting the space. We have this week, we have a birthday party, and we have alcohol ink classes. It's a painting class. We just have a lot going on, and always having something new with the building. So today I went downstairs and something was leaking. So I called Matthew Mack and he came and fixed the problem. So another knock on wood. I hope when I go there tomorrow, it's still holding, but one day at a time. Any questions, gentlemen?
No. You're looking for your funding for the upcoming quarter, right?
Yes, that is what I'm looking for.
I'll make a motion to approve the request for the 3rd quarter, is it, or
Fourth.
fourth quarter funding?
Okay, we have a motion to approve the 4th quarter, seconded by Commissioner Pierce. Any discussion? All in favor, say aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
Thank you, Lisa. Mr. Brad.
I'm next.
Yes.
I'm here for the full year of funding. We don't ask for it quarterly, we ask for one big chunk, but I wanted to bring you up to speed real quickly. I've been talking to a lot of you about the regional workforce improvement. I think it's impact program correctly said that the Department of Commerce has. And we found out today we have a letter of intent that looks like that we're going to be successful with our career or mobile exploration unit that we talked about. The idea of taking a vehicle to communities and talking to them about the jobs and careers in our 6-county Region 3 area. So that's looking real good. It's going to take 6 to 8 months for that van and mobile unit to be put together and available. So it'll impact hopefully kids starting in probably the May-June timeframe of next year. But the full $1 million of money for Region 3, about half of it was for childcare programs and grants as well. And it looks like that's going to be approved as well. We didn't get the letter of intent. We've got some questions we have to answer on it, but I think we get that as well. And that's about 3-4 of the childcare centers are located in our area that'll see close to $400,000 in grants to help them as well. So a lot of money to childcare, a lot of money to the recruitment and aligning of our regional youth. In our Region 3 6-county area, would you believe there's 4,300 15 to 19-year-olds? And the goal is to keep more of them living and working in our region with good paying jobs by aligning with the careers and the jobs that we have in that region. A lot of them don't know about the jobs or companies. So that's what the whole plan is for. So that's a quick update and the request for the funds as well.
Who would be out hitting the road in the van?
We've got about 3 different people we've talked to as kind of part-time job coaches, we would say, along with the CEO or a president of a business or HR director of a local business. So I'll use Leading Edge example. Crystal Beggs is HR out there. Leading Edge does a lot to keep diesel technicians in our region. So she would go along with the job coach. Yours truly probably at the start will be one of the job coaches. I've been doing a lot of it with the 2020 program. There's 100 diesel technicians that are trained as diesel technicians within 80 miles of Devil's Lake. 100 diesel technicians, 20% of them are going to retire this coming year. So when you look at those numbers, you've really got to do a good job of kind of filling those roles, and that's what we're trying to do. Any other questions?
Commissioners?
Good.
Thank you.
I'd be remiss not because Brad's not somebody that would brag about himself, but Brad was honored by his fellow colleagues as Economic Developer of the Year at the recent conference. So I think a tip of the cap to Brad and all the hard work, as well as recognized statewide for what he does for the Lake region.
Thank you, Brad, and that's right. Congratulations on that award. It was well deserved, and thanks for your hard work. So let's give him a round of applause. Okay, but more so you want the money, right? Okay. All right.
I'll make a motion, Mayor.
We got a motion by Commissioner Hamry, second by Commissioner Robbins. Any further discussion? We probably should do this roll call.
Commissioner Hash?
Aye.
Commissioner Robbins?
Aye.
Commissioner Pierce?
Aye.
Commissioner Hamry?
Aye.
President Moe?
Aye. Motion carries. Okay, commission portfolios. Commissioner Hamry. Start.
Mr. Grassgard.
Nothing to report tonight on utilities, Commissioner, unless you have specific questions to me.
That's all I got, Mayor.
Okay. Well, Rob.
Mike, got anything from sanitation?
Nothing under sanitation
Good.
tonight, unless you have questions, Commissioner.
Nothing. Rob?
Good on the assessing side.
Okay. That's all I have.
Okay. Mr. Robbins.
Streets,
Nothing for streets, and
engineering.
with engineering, you would have noticed that there was some water main work being completed south of Western Bank, adjacent to what was US Bank. We ended up adding some pipe bursting to the open project that we have. There was an old cast iron 10-inch main that was very close to that building, and we had several breaks on it, on that section of main. And so because of the proximity to the building, the sidewalk, other infrastructure in that area, we ended up pipe bursting that. That main had been turned off and it was capped. And I understand that that building is being sold. There's an interested buyer, so we have to give them water service. So we ended up pulling a new main in that section. It's hooked up, it's chlorinated. We just have to get it tested and we'll put it back into service. That's all I have for our project, other than what's on the agenda later on tonight.
Thank you.
Okay. Commissioner Pierce. Portfolio.
Chief Bennett, you there?
Yep. So we had one of our employees turn in his 2-week notice. He'll be done on November 29th. So we put a call into HR. She informed us with it being in such close proximity to the last hiring, we were able to go back to that list and hire off of that list. So we offered that position and hopefully they'll be starting on November 2nd. We also have school tours throughout the end of October, and then we had a flu shot clinic last week. So.
Okay. Okay. Thank you.
Yeah, I just wanted to add that last I was told Angry Beaver is still working out there on the tree trimmings and stuff, and that's about all I have. Thank you.
Okay, thank you, Commissioner. Okay, Chief.
We have to ask to see if we can get our 2007 Chevy Impala surplus. Gotta get permission to, either sell it or trade it in.
So you want to declare it surplus?
Yep.
I'll make a motion to declare it surplus.
Motion by Commissioner Hamry to declare it surplus.
Second.
Commissioner Hatt, second. Any further discussion? None being, all in favor, say aye.
Aye.
Opposed, same sign. Motion carries.
That's it.
That's it?
Yes, sir.
Wow, okay. Old business, there's nothing. Consent agenda, nothing. Okay, now, first item on the business line is healthcare initiative, letter of intent. And I realize there's a lot of people here that will probably have an interest in this, so we'll get this here started, and then afterwards, we will allow a little comment period for those that have something to say, okay? So, letter of intent. And,
President Mo, members of the commission, this is an item that we are pretty excited to bring forward to you tonight. It's something that's been really long in the making. Healthcare has been a big topic of interest for the community over the past 2 years, and it's taken a lot of diplomacy and a lot of advocacy to bring us to this point today. I'd be remiss not to mention former Mayor Dick Johnson and his role in bringing healthcare to the forefront of the public conversation in this community, as well as Mayor Mo yourself, as making sure that advocacy efforts and keeping our foot on the gas was something that we continued to do, even though we had a change in mayoral leadership. So I think both Mayor Johnson and Mayor Mo should be commended for that. And a quick little background on this letter of intent and how we got here today. Essentia had approached community leadership a while back on becoming part of the Devil's Lake story and positively contributing to the improvement of the healthcare quality and access in the region. And since then, they've purchased land in the community and have really been engaged with both the city and Spirit Lake Nation. And at the same time, both Essentia and Ultra have had conversations on how they could potentially utilize the strengths and resources of both of their organizations together to benefit the region. And all those things combined has brought us to where we're all ready to commit via letter of intent to working together, the four of us, Essentia, Ultra, the city, and Spirit Lake Nation, to work to create a medical campus here. The letter of intent is basically a document which communicates that these four entities will exclusively work together on this effort, which also sets a couple aspirational timelines as far as entering into agreements, as well as final completion. I would think of it as a document that publicly communicates that these folks, these four entities, are going to all work with each other on this initiative moving forward. With that, we have Dr. Bill Heegard, the president of the Western Market for Essentia Health, here, as well as Ultra Health CEO Todd Forkel. So we want to thank them for being here, and we'll turn it over to Dr. Heegard, and then the CEO, Todd Forkel of Altru, where they'll all have a chance to talk about their organizations, how they see themselves part of the Lake Region story moving forward, and as Altru, the past, present, and the future. So would welcome Mayor, if it please you and the commission, Dr. Hiegard and Mr. Forkel.
Absolutely. Welcome.
Well, thank you very much, and I'll keep my comments relatively brief, and then I'll hand it over to Todd Forkel. But first, I want to say, Mayor, thank you, Commissioners, Spencer, thank you all, citizens. I appreciate the opportunity to talk to you. This effort really hits upon something that, at least through Ascension, I know with Altru and others, our mission is to make a healthy difference in people's lives. And we say that very specifically. People's, we use it because it's not just a patient, it is a patient, it's family, it's the community. And as we look at this, we're excited to try to look to the future and develop a different way of delivering healthcare in Devil's Lake and the Lakes region area. We're excited about the prospect of delivering high quality and what we call integrated care. So care that it won't be everything. We're probably not going to be doing neurosurgery up here, but we are able to deliver high quality care for the citizens and the folks that need it and need it in this region. We have had a big commitment to rural health care for a long time. And we believe by working with trusted partners, both at the city of Devil's Lake, working with Spirit Lake Nation, working with Altru, we've had a long standing working relationship, and then Essentia, we can create a future and a medical campus that's going to be able to serve the community and the citizens. Last thing you know, you heard this, that we have went out and we purchased land. It's right adjacent to the Walmart. We're excited to be able to share with you, and we'll engage the community to be able to get input on how we want to develop this. There'll be more on that on Wednesday, and we're looking forward to partnership. I want to be clear, we don't have all the answers yet, but what we are doing is saying we're looking forward, and we're going to create something that is sustainable, and that is something that we can do to really improve the health and the region and the healthcare that is provided for all the citizens here. I would say also this is an interesting effort to try to solve complex problems in healthcare by a coalition and a partnership. And that's something that could be a model for the region, and it could be a model for the country. So I'm looking forward to leaning into that and really providing the care and getting the energy surrounded in real positive ways to be able to serve the community. So thank you with that. I'll let Todd have a few comments, and then we'll stick around and
Thank you, Doctor.
answer any questions.
Thank you, Dr. Hiegard, Mr. Mayor, council members, Chief Spencer. We appreciate the opportunity to be here tonight. And earlier, Spencer made the comment about being part of the story, and I'd be remiss if I didn't say Altru is deeply committed to the story of Devil's Lake and the Lakes region here, and also feel honored and privileged to have been part of that. So more than 20 years, we've been part of this community, investing in it, a new clinic, new technology, and of course, a workforce that I'm extremely proud to serve as their leader. And we are nearly 100 employees, 12 providers, with a couple more joining here very soon. And so we also want to, being part of this community, we also want to be part of the solution as we move forward and look for what are the ways that we can improve access, improve care. And so very proud to be here tonight again, along with Dr. Hiegard from Essentia, to bring forward the collaborative approach as outlined. And in my 30 years in healthcare, I have not seen a creative partnership quite like this between the city, Spirit Lake Nation, Essentia, and also with Altru. So very looking towards the future, very prideful and looking forward to that horizon of what can be accomplished. And so again, thank you for allowing me to be here tonight in terms of the letter of intent. and also look forward to Wednesday as a launching point for that future. So thank you.
Thank you. Commissioners, any questions there?
I'm fine.
Okay,
I'm good.
okay. I understand there's anybody from CHI wishing to speak or just listening, or Mary Ann? Would like to give you the opportunity to say anything.
Thank you. Mary Ann Doling. I am the current president of CHI St. Alexius South in Devils Lake, North Dakota, as you know. So I find this to be interesting that, and I guess I have one question of Dr. Heegard. I know that you made the comment that you're very much into rural healthcare and you've expanded your markets. And I guess I'd like to hear a little bit more about in some of the communities that you've been in similar size or even smaller ones, how you've enhanced the healthcare in those regions. And I realize you're looking at a different collaborative model. But I would be interested in hearing that, how you've accomplished that in other places as well. And as, of course, we are just as interested in providing healthcare. And I don't think I need to remind the people in this room that we have been here for many, many years providing that. And I don't think it's meant as a slight against the hospital to have quality of care, but I do want you to know that we score very high on our safety, quality, and actually patient satisfaction, which I think a lot of people in the community don't think that we do that, but actually we have records to prove that. So I guess I'm just here more to listen, to see what you are planning. And it's not that I'm not unaware of this, but I would like to hear more about the improvements and especially the collaborative effort. And then I would also like to hear more about how this effort is going to solve the issue of what we see in our ER as well. And that is a lot of, we take care of a lot of trauma in our ER, and we also have a lot of behavioral health issues that come through there. We also have quite a bit of addiction issues that come through there. And we actually end up to be a behavioral health hospital. So rather than focus on as well of the surgery needs that we absolutely need and the specialty needs in this hospital, I would be interested to see how that collaboration is also going to occur, because that can create a huge strain on our healthcare system as well. So those are the things that I would be interested in. And then my staff is very passionate about being part of our hospital as well.
We certainly know the staff in the hospital has been good to our community for many years. You know, and I know there's nothing opposed to the staff. It's just the community, we need needs. We have concerns, and we're trying to address them at the request of a lot of the people, citizens of the communities. So with that, I don't know if there's nobody else wishing to speak. We do have this, ma'am. Please address the podium and say your name.
I'm Kimberly Scheid. I'm currently the lead OR nurse at CHI. I am new to Devils Lake. I've only been here for like 3 months.
Well, welcome.
Thank you. So I am not necessarily familiar with CHI as a corporate hospital, how all these things work. But as the lead nurse, I'm in charge of finding staff to staff my ORs. And I don't know a big shiny new building is going to necessarily bring new people and new younger people that want to work here, and even physicians who want to be up here, living up here in Devils Lake. It's kind of, I'm originally from South Dakota, so I understand the Midwest and everything else about it, but it's hard to explain that to someone who hasn't been here and doesn't appreciate the wide open spaces. So I am curious, once this hospital is built, where they plan on finding the staff or what they plan on doing to retain staff and just find them somewhere. Because not being a part of this community, but hearing that there's another big shiny new hospital, and then also being oriented to this hospital and finding out what it was like starting this hospital and that it was built like with this town. And then it seems like people are kind of turning their back on this hospital versus trying to like bring it up new to the community. It's kind of like what they're trying to do with the school. They're trying to make the school either tear it down, but most people are like, it's a historic building. It's part of what makes Devil's Lake. So why would we tear it down? Why wouldn't we spend millions of dollars to bring it back up? Lots of things I don't understand, but those are just my interests.
Well, thank you for your time. Anybody else?
I do have a question there, Mayor. In here under number 3, definitive agreements, bottom sentence of it says, it is not anticipated that the tribe will provide financial support from its own funds for the development of this healthcare campus. Well, also in here, I do not see anywhere that tells us what the city's costs are going to be on anything. No formulas, very, very hard to agree to something when they want us to pay for something, but or help with costs when there's no dollars, no formulas, nothing in here.
President Mo, members of the commission, if you, in going through the letter of intent, you'll hear that the term definitive agreements. So what this letter of intent does is basically communicates that we're going to exclusively work and negotiate with one another. And as part of those definitive agreements, in building a new hospital, we're going to have to get into a development agreement with Essentia and Altru, as well as who's, as far as the financing of the infrastructure in the area there. And that'll be before the commission for your approval. So you will see that then. This is basically just publicly communicating that we're exclusively working together on this development of this new healthcare campus, and any direct involvement that the city would have as far as financing in the surrounding infrastructure and the development agreement will come before the city commission and will require your approval. So as far as dollars and cents, you will see that in the future, and you will be able to ask any questions of staff, and it will require your approval.
And the other question is it's, to me, it's kind of odd in the healthcare system, but what is your partnership between Essentia and Altru going to be? I mean, really, you guys are competitors, but now you're working together to bring this. Is Altru going to abandon their new building? Are you going to share services, staff? I mean, what's it going to be?
So just as Spencer outlined, for us, as a not-for-profit system, we need the letter of intent to actually sit at the table to create the potential for the definitive agreements as outlined. So I don't have 100% of what that may or may not look like, but I would imagine that what we do well in this community on the outpatient side, the physician provider side, that we would continue to bring that to the table. And as healthcare has gone through so much transformation, in particular in the last couple years, the ability to leverage each of our talents in the end, I believe, will bring a better product than any one of us individually moving forward. And that's what brought us, Altru Health System, to the table to see if there's something that we can work out.
So question with that then is, I know Sanford come into Grand Forks, correct?
Well, that's been rumored, although no announcements.
So, I mean, if that was the case, you guys want to bring your talents together, why didn't you guys sit down in the table at Grand Forks, Altru and Sanford?
Altru and Sanford?
I mean, if it's just a rumor that they're coming to Grand Forks.
I'm not behind the curtain at Sanford, so I don't know what their strategic intent may have been or maybe in the future. So I can't really answer that question.
Commissioner, I'll just add from the census standpoint, I think you said, we do compete, but we also collaborate. We collaborate with common spirit in certain areas as well. Park Rapids is an area for us. Those definitions, I think what really motivated us, and I think Spencer said it well, is the LOI allows you to be able to sit down and actually try to figure out all those, and I'll call them work streams. How do you do this? One is financing. How do you recruit? How do you do other things to be able to really serve the community well? So that allows you the environment to be able to start really trying to address these. And good questions, great questions, but we collaborate on a number of different things, which is appropriate as well.
Any further questions?
Hello, gentlemen. Danica Coaches-Spilek. I am a med-surg PDR nurse at the hospital. And what I hear as a community member, we were transplanted, my husband and I chose to come to this community 10 years ago. We brought our children, we've raised them in the Devil's Lake school system. And they have gone on to successful careers. But what I hear happening here is that if this letter of intent is entered into, what is happening is what I hear is a loud cry from this office that this community has no more belief in the ability of the nurses, those of us who are standing on the front lines, taking care of these people who come to us every single night, that we are going to have to be, that basically you're all saying to us, hey, we don't trust you to take care of us because we're entering into this community, entering into this agreement. And then that's going to say further to the town that, well, we really don't think you're able to take care of us, but we really want you to take care of us for the next 4 years while this new agreement is brought into the community. And I feel as a community member who just watches and hears and sees how my kids are treated and everything else like that, there's an awful lot of division already in the community. And this will further create more division amongst us if this letter is signed. I'm not sure that it is the best thing to enter into an exclusive agreement while cutting out the hospital that has been here, while saying to the people who work there, no, you really aren't good enough to take care of everybody else. Because that's what it feels like to me as a nurse who comes to work every day and busts it to try to take care of people. So that's my feeling and that's my impression that I have from listening to all of this. And it disturbs me greatly. And it disturbs me to the point of thinking that maybe Devil's Lake doesn't need to be our home anymore. And I think that that's going to be a message that you may send to other people in town. And I think it's worth thinking about. Thank you.
I'm just going to say one thing there. I think in the discussions that I've been in, not once has anybody said anything personally against an employee or any staff. It's always been the system that they work for that the complaint has been said to. But I understand that, but no, that's couldn't be further from the truth. I mean, that is as far from the truth as you can get.
It's very hard to follow because it's really heartfelt and it's something that we see every day.
Could you please state your name, please?
My name's Lynn Emmel. I'm the radiology director at the hospital.
Thank you.
And I can tell you that people that are coming to the hospital every day and the people that are caring for each other are members of this community and they love each other. And it's very hard to see this. But I would ask, as a business person and someone who buys $1 million machines, that I would say I don't understand ever the idea of an exclusive agreement being the best for the community or for one organization. When you look at exclusive relationships, those relationships can't be as competitive as they can be if they're open to others. So I would think that it would be unfortunate to have an exclusive agreement for the city.
Yeah. President Mo, members of the commission, just in regards to the exclusiveness of it, of the agreement.
Yeah.
As Mr. Forkel had mentioned, with Alter and Ascension being nonprofits, to sit down at the table and negotiate these things, it does require that letter of intent, which is why it's before you tonight.
Right.
Tara Erickson, Human Resources at the hospital. Sorry, I'm emotional right now, but this hospital has been here for 120 years.
Mm-hmm.
Sorry.
Right.
I was born and raised. I've lived in this community my whole life. We have people here for 40 years, 45, 47 years that have worked here. And by the statements that you guys make with that, and that they're going to provide better healthcare or the healthcare that we need, we are definitely providing that. But you're also driving away people that have been born and raised here because there's a good chance that 2 hospitals can't survive. Well, guess what? The only other option, if there's a job there, is to go to the competitor then. Or guess what? Some of us in an HR role might not even have a job there. So I'm not going to find a job here in town. So you're going to drive me or make me leave this town because you want to be in an exclusive commitment with them. You guys haven't, where has the financial, you want to possibly be financial backing for them? Where's the financial backing if we needed it or come to terms? Where have we've been brought into some of this? And that's all I have to say.
Thank you.
I'm Terry Mertens. I'm the supply chain manager at CHI St. Alexis Health in Devils Lake, and I do also oversee multiple facilities within CHI in the North Dakota region. I'm proud to say I work for CHI St. Alexis Health. I've been there for 40 years prior to them becoming CHI. And what they do for us, for the facility, is wonderful. We have wonderful benefits as employees. You know, we're not people that go out there and, oh, we got a new piece of this or we got a new piece of that. And I heard from the former meetings that we had with Altru, CHI doesn't put anything into the facility. They do. I just heard Lisa talking about the infrastructure of their roof. We just replaced that roof. We've spent a lot of money on the infrastructure of our facility trying to make it better. Now, my question right now, we're critical access hospital. It is, I think you cannot have two critical access hospitals within a 40-mile radius, or you can't have a hospital within a 35-mile radius to claim the critical access. Well, Devils Lake, I do not think is going to be a tertiary hospital, right? You're not going to have cardiologists on hand. You're not going to have pulmonologists to take care of patients in the facility. You know what? They're going to be transported to a tertiary hospital, which is happening right now. Now, the former mayor, Dick Johnson, that was his, oh, I hate seeing all the ambulances transferring to Altru or transferring to Sanford, transferring to Essentia, to Minot. But that's where you're not going to get those kind of physicians, specialists here. If we were a metro place, yes, you're going to get it. There isn't a place in the other facilities that I have that don't have the same issues that we do. They stabilize them. They take good care of them up front. Our ER, your doctors, what's that doctor's name? He would take our ER patients. He was at the last meetings. Marveled at how our patients were treated, stabilized till they got to the ER in Altru. So we're doing something right here. So by sideswiping us, by the way this has happened, it just infuriates me. I think the city and the good old boys club got some erroneous information from a past employee that they're running with that, and it's false. I think you guys should sit down to the table with others that maybe know a little more than someone that was a little disgruntled in the first place, and take a look at us. Thank you.
My name is Helen Earley. I'm a nurse, I'm a mother, I'm a member of the community for the last 10 years. I worked at CHI St. Alexis in the ER for the last 10 years and recently left and went to Altru. As I'm an MP student, my partner is a med student at UND. The healthcare in this community is my life's goal now. Okay, I'm a Devil's Lakean at this point. Okay, I was from the beach. I was from North Carolina. This is where I am, and this is where I shall be. This is where I'm going to provide care to my patients. This is where my partner is going to provide surgical care to her patients. But where are we going to do that? Okay, CHI for the last 10 years has been saying things and saying things, and I loved CHI. Okay, for very many years, I was proud to say I worked there. But the bottom line is the community needs health care. Who's going to give it to them first? If it's CHI, get it. If it's this other partnership, get it. We need health care. We need healthcare.
Agree.
Thank you.
Thank you. Okay, that it? Okay, question before us.
I just have one question. I don't know how it's been, but what is the mission statement for Essentia? What is your mission? Every hospital.
Make a healthy difference in people's lives, in their communities.
Some places have a goal of reaching such and such a profit. What is yours?
That's what I just said.
President Mo, members of the commission, I would just add, before any motion is taken, that the city attorney has reviewed this and has given approval, that he believes it to be legally sound for the city to enter. So.
Well, I can tell you through when I was running for the position of mayor, I had many people come up with concerns about some of our healthcare simply because of surgeries. People have, I love CHI. I was born in Mercy Hospital and I was there myself. I'm a long-term resident, and hospital care is necessary, but we are sending people all directions. The ambulance service is continually moving as soon as you get up there. And I've had people tell me it's a Band-Aid station. I hate hearing that. I served on the board. You want to be, proudful and prideful of what the community gets for your healthcare. But when it comes to a rotator cuff surgery, you can go to Grafton and get a rotator cuff surgery. You can get other surgeries in small communities. We can't do it here. And we've been promised doctors to be able to have surgeons. We need a surgeon continually here, and we don't have that. And that's the concern of our people. I've lost 2 neighbors in my neighborhood because they moved out of town for concern of healthcare. And they're great neighbors, but they were concerned that the other, you don't have an oncologist or I'm sorry, maybe I'm wrong, but that does a ultrasound person. I mean, I experienced that on a personal basis. When you go up there with the emergency, you got to count on being taken care of. Your option is to either leave to go to Grand Forks or go to Minot. Well, that's not what we want to do. We want to go up there and have count on our services there. And it's very important. And I don't want to get into an argument back and forth. Please don't.
I just want to say though.
Yes, Terry, I'll allow that.
Please come to the microphone and the podium, please.
There's nothing more than we would love to do is surgeries. We would love it. But you know who is the primary surgeon employer? The clinics. Whoever the clinics may be.
Okay. Well, anyway, this is some of the concerns, and I heard it a lot through the community. So I'm not lying about it, that the people are concerned and they really are asking for someplace they can count on, whether it be CHI, Essentia, Sanford, whatever. They were just wanting the ability to be taken care of and count on it. Okay. There's nothing against the employees at Altru or CHI that you're great people. You're great community leaders. We count on you guys, but it's just, we got our residents need to be able to, I just talked to somebody in church yesterday. They're moving because of concerns. They got heart issues and they're concerned if something happens, and they're not confident here. So
President Mo, members of the commission.
Mr. Mayor?
Yes, Commissioner.
I just want to say to all the healthcare workers there, as a former healthcare worker myself, this is not in any way a slight to your abilities or what you do. I worked in surgery at CHI when it was Mercy Hospital. I was a surge tech for over 10 years. And from the surgeries we were doing at the time that I was there to the available care now, surgery-wise, is heartbreaking to me. When we were going from doing hysterectomies and cataracts and just a gamut of surgical procedures available to what I see now there, and it's heartbreaking. And when I was running for commission, the same concerns were given to me by the people of Devil's Lake. I know it feels like it's a slight towards you as a health professional, but that is not the intent. I just wanted to make that clear from my perspective.
Thank you, Commissioner.
Thank
I'm Dave Schmidt. I'm one of the ERPAs here in Devils Lake. Been here for 9 years. Seen a lot of your families,
Mhm.
a lot of you personally in the ER. We're not a Band-Aid station. Anybody can
And I
put a-
believe that. I'm sorry
anybody
if
can
I
put a
offended
Band-Aid on.
anybody.
No, that's very offensive.
I apologize. I'm very sorry for saying that.
I go to Altru and I do my training at Altru. We have Altru doctors as a chief of staff. So we have a partnership with the Altru physicians. That's not the problem here. We work with them every single day. I call them, they call me, we refer to each other. So we are coordinating. Is this agreement going to guarantee that we have surgical services, oncology? Are we going to have all of these things 24 hours a day, 7 days a week? Because if not, I don't know what this agreement's going to do to help things. We got a hospital here. We have a whole plan to develop new updated facility. And if anybody wants to come up and see it, it's right up by Mary Ann's desk. You're welcome absolutely anytime. But I take exception to being called the Band-Aid station.
My apologies for that, but that's what was told to me from some of the residents. And I'm just relaying the message too, so.
Yep, and I'm relaying it back, that
Okay.
that is offensive.
Okay, and I understand and I apologize for that.
So we do have cooperation with Essentia. We have a cooperation with Altru. We've been calling them all the time to transfer patients out of here. Unfortunately, we don't have surgical services at this time. Are we trying? Of course we are.
Okay.
I just want to guarantee if you're gonna enter into an exclusive agreement with some entities and are thinking of putting funds into something, maybe you should include what's here, what's now. Because things aren't going to improve until at least 2027 by the agreement that's proposed right here. At least 2027. Thank you.
Thank you. Okay, we're going to close all the discussion now and discuss the letter of intent with the commission.
President, members of the commission, I would just since becoming here as the new city administrator, I think everyone's recognized the well-intentioned and hardworking folks that work here at our current hospital provider. And the conversation's always been about future-oriented. And as far as this letter of intent, this is the initial first step. And as a community, the hard work is really ahead moving forward. And so just want to make sure that you guys, this is a necessary first step to move forward on these things. And there will be many conversations on it moving forward, especially being as the city will be involved if development ends up occurring. So we'll leave that before you.
Okay.
Okay, well, I'll make a motion to approve the letter of intent on the city's behalf.
Motion by Commissioner Robbins,
Second.
second by Commissioner Pierce. Any further discussion? No further discussion. Roll call, please.
Commissioner Ash?
Aye.
Commissioner Robbins?
Aye.
Commissioner Pierce?
Aye.
Commissioner Hamry?
Nay.
President Mo?
Aye. Motion carries. Next item, computer data dispatch, staff report. Spencer, please.
Just give a second while the room clears out.
Okay.
If you're okay with that.
Nobody wants to hear about infrastructure. I'm a little bit surprised. Water main replacements.
Nobody wants to hear about the CAD program? This is my big show.
Thank you, guys.
Thank you.
We want to hear about the CAD.
Yeah, hey.
The cool kids in the
Really?
back of the room.
Well, you guys are here for two different things.
President Mo, members of the commission, as we discussed at our last meeting, we came back with a couple funding options to put before you for the CAD system. And as per those discussions, there's that initial cost up front, as well as reoccurring costs for the police and fire departments. As part of that, we developed three options for you. The first option A being the, just paying for the cities and the city's portion being the police and the fire departments, with a total $82,500 just to pay for the city's portion of it. There was a desire amongst the commission to put a larger portion of the bill, given the influx of federal money that we received during the pandemic era. Option B is a cost share with the county to propose to them. And option C is footing the entire bill, the full 195. As far as option B, before you, option B is what's recommended. And
I'm sorry, Spencer, but if you're looking,
Yeah, that's what I was.
staff report on
There we go.
on
Got
a
it.
computer, if you pull that one up, they were looking through the paperwork and finding the staff report.
Yeah,
Oh,
there
my
it is. Thank you.
it should be the first link, I believe.
Yep.
And so option B is the city footing its portion of the bill and the county footing their portion for the sheriff's office, and then with the remainder, splitting the remainder. So if we do that, the city would end up paying about $121,000 and the county about $75,000 per that cost share. And, you know, originally we were thinking, well, let's just split it 50-50. And I do have to commend Commissioner Robbins for pushing us on trying to make something more appealing to our partner, because being as our initial startup costs are much more than theirs. And so if we did go 50-50, they would pay a disproportionate amount of that remaining cost. So I do want to thank Commissioner Robbins for pushing us a little harder and coming up with a better plan. So our recommendation is to pay for ours and the county pay for theirs, and then we'll split the remaining costs with them, for the city to pay about $121,000 and the county to about $75,000. And in talking with Chief Kanowski, he has plans to represent the city at the county commission meeting tomorrow with whatever the city takes action on tonight. So if the chief would want to elaborate on anything I've said, please do.
Well, as you can see on the papers that I sent out, all the breakdowns that we were looking at, the reoccurring cost is probably the one that everybody's kind of alarmed about when you first had the initial number of $133,000. But if you look at the total cost that we're going to be end up paying ultimately, if you turn the pages towards totals of by county and city, our total would be $38,000 a year. And talking with Administrator Halverson, he was indicating that some money can be pulled out of equipment and stuff like that. And
Yeah, equipment reserves, and we'll have a further conversation on the equipment reserve moving forward as far as the reoccurring costs.
yeah, and some of that stuff. And so the cost wasn't that much of an issue when you talk about recurring costs. And but the initial cost was the part that was going to get us into some trouble, right? It was $195,000 for the whole program, for all the entities to be involved that would have to come up with money. Previously, and in speaking with Rob Johnson, who was actually the one that spearheaded this initially, and thanks, Rob, for doing all the work and me just, doing all the other stuff. Initially, it was going to be very difficult for us to come up with $195,000. So Commissioner Robbins stepped up and said that, we would come up with some ideas that using that COVID money would be able to cost for some of that. If you have any questions in regards to this, all it is really about the entities, and that was actually Rob's breakdown, and it's if you even broke it down per population, it'd probably come up the same way. So our initial cost would have been about $82,000 with the initial cost if we were going to come up with that, our portion. There's options that are involved in this that the administrator came up with. If you want to look at those and come up with a good idea as what we can come up with and kind of money wise. I venture that you guys come up with a good idea. So if you have any questions in regards to these breakdowns, I'd be more than happy to go into it.
No, I'm still set kind of on Dale's idea at the last meeting where we just picked it all up, got it rolling.
And initially, that was my first impulse. That was my want initially, to just pay for the whole thing. Had a few conversations, spoke to a couple of county commissioners, expressed to them that how would they feel because I did step up and talk to them personally, say, I think we're going to take care of the whole thing. And then I went back to them and said, well, at this point, let's see about you guys picking up part of it. Spoke with Spencer, that splitting it down the middle didn't seem appropriate because, like you explained, splitting it down the middle disproportioned the burden on the county as opposed to the city, because if you break it down to where it should go between all of the entities, we'd got hit for about 80 grand. The city or the county would have got hit for about 40. I'm just speaking loosely. So that would have been 120 of the whole project. If we said we were going to take 100 and they took 100, they were going to be kicking in 60 and we were going to kick in 20. So talking with Spencer is like, let's split the shortfall and give half of that to each of the city and the county. For the numbers that he came up with here, the city 121 and the county 74,000.
Well, what's 33% of that 74,000?
Yeah, if you want to look at it that way, yeah, we can always look.
I mean, our city is going to pay for 33% of that 74 because they're going to use a county mill and not a rural mill on this.
Correct. Yeah. I mean, everything we do, we could look at it that way, but I'm like, say my initial hope and want was to pay for the whole thing. I'm okay with this. I talked to a few of them. I called Adam, I called Ed, I called, who are the other ones? And expressed to them that we're looking at approving this tonight in this format. And they didn't seem to have any heartburn over it.
You're talking about option B.
Option B, yeah.
So, I mean, in the end, they're going to end up paying 50,000 and we're still going to end up picking up 146,000 of it. Because 33% of our taxes go to the county into their rural mill or their county mill.
Yeah. President Moe, members of the commission, I would say that the county has been pretty open that they're sitting on the influx of federal money that we've also saw too, and they're trying to strategize how to spend it. I believe this was a part of that overall grand strategy on what they might use as far as an investment in the sheriff's office. And I would say as far as the procurement of the software itself, like I said, with what the city commission approves tonight, Chief Kanowski will be there representing the city at the county commission tomorrow. So as far as the procurement goes, it's going to get started up as soon as it possibly can. And once if we select an option and the county gives a thumbs up to it, we're on the we're rocking. So.
And if I could add something, this dollar amount will change at the first of the year according to the representative. So this isn't a set in stone for 20 years that this is what it's going to cost, right? So my thought is that it takes an entire year for them to get everything installed, everything working, everybody trained up. So the first actual reoccurring cost at 133,000 would come in 2024. So we can actually plan to budget and have other county members budget accordingly too. So but getting it started now, we can lock in the price and then also get it rolling. So that's why we're kind of pushing it.
So then just on that, then if they give a thumbs down, then we come back in 2 weeks, right?
Certainly.
So it'd just be 2 weeks down the road, the can would be kicked even longer.
I think with the county, I think we've proposed an option B, a pretty equitable solution towards it, given their upfront costs, our upfront costs, and the desire to get this thing moving fast and splitting it down the middle, and really a partnership where we're going to go farther together than we would be able to all by ourselves. So I think it's a fair proposal, and if they aren't on board, then then that'll be a future conversation. But I don't suspect that. And I would say, as far as the reoccurring cost, future down on the meeting agenda, we're going to talk about the equipment reserve CD, and I do have a couple strategies on how we can alleviate the burden to the general fund and funding that roughly $40,000 annual cost. So.
I'll make a motion for option B then.
I'll second.
Motion by Commissioner Hamry, second by Commissioner Hatch. Any further discussion? Roll call, please.
Commissioner Hash.
Aye.
Commissioner Robbins.
Aye.
Commissioner Pierce.
I lost him.
Sorry. Aye.
Commissioner Hamry.
Aye.
Commissioner Hash. Oh, sorry, President Moe.
Aye. Motion carries.
Sorry, I had it on mute. Driving through rush hour traffic in Chicago. So.
Oh, be careful. Okay, that's next item is the loan guarantee Western State Bank Kojak snack pack.
I think
Nope.
we have one more.
What? Oh, I'm sorry.
Equipment
My
reserve CD.
equipment, okay. Thank you for helping out. Okay, Spencer?
So just a quick rundown of how the equipment reserve works, and then suggesting just a slight change. But first, I'll start off with the CD rates, as our equipment reserve just matured. And, I informally pulled the local banks on what their CD rates. Most are still under 2%. Edward Jones is offering brokered CDs at around 4%. And so there's a real opportunity to take advantage of there. There's slightly different way that everything is federally insured. Currently at the bank, we have, roughly 2.5 million, and it's pledged, or it's insured by pledged securities. With this, each CD is brokered up to $250,000. And so what we'll do is we'll have multiple CDs that are about roughly $250,000. They'll all be FDI insured, and we'll meet state century code obligations, and we'll be able to take advantage of the 4% rate versus the 1.55, which was offered for our renewal. In the aggregate, it'll be the same amount. In the aggregate, with the series of CDs at Edward Jones, in the aggregate, we'll get that 4% return. And so number one recommendation is to transfer the financial institution for the equipment reserve from Bremer Bank to Edward Jones to take advantage of the substantially higher rate. Normally, we've had it at Bremer Bank, and they would just give us a renewal rate, and we just kept it at the same financial institution, so that's why it wasn't brought before you guys. But just because we're transferring, we want to bring it forward to you guys. As well as the second recommendation is to change the strategy that we currently utilize with the equipment reserve. In the past and currently, it previously worked like this. So if a certain department had a percentage of the equipment reserve CD, so let's say there was $10 in the bank, and the street department had $1 worth of that $10. Well, they would receive 10% of the interest earnings that the CD earned, and we do that for every single department. And with that, when we split it up so much amongst all the departments, we really don't accomplish a whole lot of our goals. When we buy equipment, it's just slightly less painful instead of really feeling a big punch from the benefits of those interest earnings. And so really what the recommendation is, and we've talked about police and fire's equipment reserve and how it's a burden on the general fund when we have to purchase expensive equipment. And so the recommendation is to direct all the interest earnings to the police and fire department's equipment reserve. Equipment reserve, 75% to the police department, 25% to the fire department. And so then when we have these reoccurring costs like the CAD system subscription, as well as police and fire trucks, we can transfer money from the equipment reserve into the general fund, so it's not as much of a burden to our property taxes. And I would be remiss not to talk about streets. As far as their equipment, it's really expensive and it's in the general fund, but we do send $100,000 every year from our highway distribution fund into the street department. And police and fire don't have it. Yes.
When was the last time the city bought a fire truck?
It was 2 years ago, wasn't it? $650,000.
I don't think he means for fire trucks, but for if the fire department was to want to increase their budget and ask for more money from the city, I think is what the intent was, not to pay for.
There's some,
their equipment.
they haven't bought a fire truck in many years.
204 would have been the
Well,
last
we
one.
bought a truck, but it's been volunteer.
204 was
The volunteer, yes.
Yeah.
Yep.
Yeah.
And, we were talked about trying to get the police department into 2 squad cars a year versus 1. We just added the $40,000 in yearly cost to the general fund. And so directing these towards police and fire's equipment reserve so we can transfer into the general fund to alleviate property taxes a little bit. And our public works departments, they have healthy reserves. And if you look at our utility rates, they are as low as anybody in the region. Is something we should really be proud of. And we have other mechanisms to help fund those public works departments. So so the formal recommendation is to transfer the equipment reserve CD to Edward Jones from Bremer Bank and direct the interest earnings to the police and fire departments at 75%, 25%.
So basically, and maybe Mike, you can correct me here, but all the money streets, sanitation, water puts into these CDs is going to end up going to these two?
The principal will not be touched.
No, principal is
The
not.
interest earnings.
Yeah.
Spencer did approach the.
Just asking.
Yeah. It was discussed at a department head meeting, and based on the strategy that's been put together for leveraging additional interest rates or interest amounts and directing them towards the general fund. Most of the other departments are enterprise funds, so we can accommodate, the equipment. We do have to look at the sewer. I think we've discussed about that. So there are, with the enterprise funds, it's just a little bit different. And if the end goal is to try and help out the general fund, this seems like a reasonable approach. There wasn't a lot of pushback. I think the fire chief did commit to not buying a lot of chrome with that money, though. It was more equipment.
Oh, you let me down there, buddy.
Make it more useful, not so pretty.
So that was kind of some of the joking at the meeting. But.
So then, if you got to talk,
I thought I learned you.
If you got to talk about sewer in this, then these percentages will be off. Because sewer is not one that brings a whole lot of money in for their equipment reserve.
That's what we'll have to talk about.
We'll have to talk about that. Yeah, that'll be at a future meeting.
Do you want us to vote on this right now, and then we'd have to change this at a future meeting?
I think as far as the strategy with directing the interest earnings to police and fire, it was something that I thought long and hard about, and I consulted Mike ahead of time about what I was thinking about, because I knew exactly what it is, right? You're taking the principle of an equipment reserve. But the thing is, in the past years, when you're throwing, for example, we have a sewer truck that needs to be purchased. It's going to be $600,000+. And, if we're directing sewers equipment reserve, the percentage is like, I forget what it is, but if we're throwing $10,000 at the sewer equipment reserve, we're not going to make a dent in the $650,000, and we're not going to really feel the benefit of it. If we do that for the general fund and some of the things that we're trying to do with the police and fire department, we'll feel a benefit to the general fund on it. And, I thought long and hard about it, about, where I think what I hear that you guys hear from constituents and where they feel that their burden, it's on the property tax side versus the utility side. And so trying to, also with knowing that we just added $40,000 every single year, I felt it was the best recommendation I could come up to do with the earnings.
So you
can benefit. Chief Bennett, are you still there?
Yep.
Were you briefed on this beforehand?
Correct. Yep.
Okay, and you have no problems with the 25%, or do you have anything to say?
The 25% was fine. We had talked about building a capital budget fund for some of the reoccurring equipment that comes due at the end of life stuff. So part of that was what Spencer's talking about right now.
And when you're talking about the sewer, you're talking about increasing the rates on when we go over rates and fees.
Right now, for non-oil producing municipalities of significant size, we are the lowest rate. And so we might need to have a conversation on our rates. And I would say in general, with the current strategy, that fund has run a slight negative balance the past 2 or 3 years. And so we're going to have to correct course on that. And so we'll have a recommendation for you guys coming up.
So it'll, in the short term, we'll feel all fuzzy and warm about the general fund until we got to drop that 600,000 on a truck. And then it's not going to be so nice then.
Yeah, and it's
on a truck for sewer.
Yeah.
Commissioner Henry, I had some of the same reservations when Spencer first approached me. In this particular case, the city administrator's thinking, in my mind, a little bit out of the box. It could have been status quo and you still get to 1.5% interest rate or what have you, and just nobody even really knows about it and you don't even talk about it, in which case the equipment reserve really isn't receiving a lot of interest anyway. In this particular case, you're thinking a little bit outside the box. You're able to, increase that interest rate to something, another 2.5% or something along those lines, which means something dollar-wise.
Well, I'm
and
not
as far
worried
as
about
the
interest rate.
yeah, so as far as the sewer department and the enterprise funds really, with the equipment, we really have to be funding those accounts.
I'm having trouble hearing whoever's speaking right now. Sorry.
If you look at our utility rates, the water and the sewer, especially, we're some of the lowest utility rates based on the survey that was provided by AE2S. And so there's some room there. And realistically, we should be charging a rate that is going to accomplish the tasks required for each department and purchase the equipment that's required for those tasks. We shouldn't have to be utilizing equipment that's, in the cemetery, for instance, we were using a backhoe there that was from the 1960s, and that was just recently upgraded in the last handful of years. But so I think, we have, as department heads, we have to support some of these some of these changes when somebody's willing to think outside the box and help support each other. And it is a general fund item. So either you're paying through tax or you're paying through your user fees, right? If you're a city resident, you're going to pay through your tax or you're going to pay through user fees. In this particular case, we're probably going to have to make up some ground on user fees because those user fees right now are so low. But we'll have to review that. That'll take some homework, and then a recommendation will be provided for the commission for the rates and fee adjustments if one is required.
Well, if we're running a negative, it's gonna have to be adjusted. And to get it up to where we're running positive, plus to try to cover, so we have enough money in there to buy something they need, it's gonna be a substantial increase.
You know, it may be, we also have to look at allocation of costs. You know, I really want to take a strong look at, from a collection side, you know, when we're talking wastewater treatment versus wastewater collection, make sure that we're allocating the costs where they should be. Same thing with the water side of the house. We want to make sure these are the costs associated with what's at the well field and pushing that water to the city. This is the cost associated with the water treatment plant itself. And this is the costs associated with the distribution system. We've been working to kind of put those numbers together a little bit better. Same thing with the inert landfill and our sanitation. Allocation of costs are very important. Not that, I mean, the end user, right, the city residents paying a bill. They're paying so much per 1,000 gallons, so much per can, so much per their wastewater. But we need to be able to allocate those costs accordingly so that we know this is what each section is costing us. And so we know where the money is going, and that's just good budget for us. And we're working towards that goal. And I think we've gotten a lot better in the last year or 2 years, and I think we need to continue that.
Well, appreciate that, Spencer, you doing this to get Mike to actually, you know, figure out his prices.
When I said, Mike, I got an idea. I was not, he Mike went, he nodded his head. I understand. I get it. So, and I can always count on Mike to give me his candid feedback. So we have a good working relationship as well with all the departments, and it was communicated in the department head meeting, and we all kind of understood what the strategy was. So it's the recommendation before you guys.
I'll make a motion on, well, we gotta do one at a time, right? Motion.
No, I have it in the staff. I have it all as one motion here in the staff report for you guys.
Yeah, I'll make a motion on the staff report.
Okay. We've got a motion by Commissioner Hamry, second by Commissioner Pierce. Any further discussion? No discussion. Roll call, please.
It works forever.
Commissioner Hash?
Aye.
Commissioner Robbins?
Aye.
Commissioner Pierce?
Aye.
Commissioner Hamry?
Aye.
President Moe?
Aye. Motion carries. Okay, now loan guarantee with Western State Bank and Kojak Stack and Pack. Brad.
Yes, commissioners, I'm here to request, as you see, the Forward Devils Lake Board made the recommendation or put together the recommendation to the Devils Lake City Commission. You guys have it in front of you. It's roughly a third of $3 million. The guarantee that Western Bank would get from the city, it's just a guarantee, once again, similar to what we did for Summers, would help provide $666,000 of loan dollars of Western Bank and the Bank of North Dakota and the North Dakota Development Fund. All three of them would be involved in and participate and provide those funds that will be core working capital, will help Kojak get to that next level, hopefully. We had a startup company that hasn't been 4 years yet, multi-million dollars, that started up during COVID. That really hurt a lot of their sales efforts. Think about it, sales efforts where you can't go out for a couple of those years, you can't go out and actually call on people. They had shows, big, large shows that were canceled that they could not go to. Things turned to Zoom meetings. As a former sales VP for 30 some years, I don't think I could have sold via Zoom. I mean, but that's what they've had to do. And they've done a pretty good job of it and had brought some really good customers on just recently as well. So these commitments will help shore up and provide the working capital to help them move forward after I put in the package here 2.5 years of challenging times. The other thing that I wanted to mention is, they're a different type of company than I'm working with right now, I got a couple of prospective ones. You know, it's a local owner that's put a lot of money in. He's put in $1 million in the last spring, as well as another $1 million as part of this condition too. So, so all in all, it's
Is that $1 million of his own money or $1 million of leveraged money?
Own money.
His own personal money?
Yes, yes. That's the information I have is his own money. So this is one of the things that, I hate to do as an economic developer, come in and ask for another tool, so to speak, for my toolbox, but it is a tool that we can use with no money out of our pocket. So over a period of, Brett, once again, 3 years?
2019.
Yeah, first year, yeah, but this is, the amortization is,
Oh, I'm sorry, yeah, we're looking for a 2-year term. So we're proposing, it's got a 5-year amortization.
and I asked Brett to be here as well to answer any questions you might have from Western Bank standpoint as well.
Could you just communicate the terms in the microphone? I don't know if it was 2 years, was it 2 years, 5%?
Okay.
Yeah, what we're proposing is a 2-year term, 5-year amortization. We're going to do 6 months interest only as he's continuing to build inventory and get into some of these new accounts, most recently Costco. He's got a brand new opportunity there down their Northwest division, or excuse me, Southwest division. So there's 60 different stores down there that he's going into in December. So we're hoping that goes well. So we're hoping at the end of 2 years, we're going to be able to refinance this debt and put it on to some longer term debt for him. So we're hoping.
Any questions?
Well, I myself, they're into us for about $2 million for the building, I believe, right? And they're making
1.5.
1.5. Okay, so we gave them a
Really,
sweetheart of a deal on that.
Yeah,
Gave them
1,450,000. I mean, they did put 50 down.
okay, but I mean, I think everything we've done for them so far has been pretty liberal, so to speak. And now, does the bank in North Dakota, are they asking for this security, or is it just Western?
It's just Western.
Just Western, okay. And just because you guys have different rules that you go by, or different, you graded it differently than they might have, or?
No, well, we seek, in economic development projects such as this. Just a full disclosure, I was president of Fort Devils Lake back in 2019 when we brought this company on. A little bit unique, Fort Devils Lake's mission is to support primary sector businesses. And really in Devils Lake, you have two. You got Summers Manufacturing with 100 employees. You got Kojak Snack and Pack with 35. All dollars that are generally allocated to Fort Devils Lake should go to primary sector businesses. So this is one of our primary focuses as a community to help. We have one in Benson County. We have Sioux Manufacturing. We don't have any commitments to them. But when this deal was put together as an economic development project, we knew that there was going to be some challenges. No one knew that we were going to battle through a pandemic. But this company has not quite met expectations, but are projecting some serious growth in the next couple of years. So you may say liberal, but being a past president, I can speak to, you're not going to attract any new companies, guys.
Agreed, I say that all the time. We agree 100%.
So I just want you to know that you might have been a little liberal in your terms, but the alternative would be, it'd be a vacant building today.
What's their payroll compared to like Summers? I mean, Summers is a
That's hard
career,
to
I
say,
picture
but
that.
35 FTEs is pretty good. I mean, we could probably back into the math, and when we did the Summers deal back at that time, egg sector's finally starting to recover. Things look well there. This is a farm to table business. Brian not only raises edible beans, his own family farm, but he also contracts with 15 to 20 other family farms, which really provides a nice opportunity for them to sell at above rates and maybe save on some shipping. They're not shipping them out to the West Coast themselves, or, up north to Pembina, other markets.
So if this goes upside down, Forward Devils, who pays back what is the balance if something goes wrong? The city or Forward Devils Lake?
Well, they're one and the same.
We would pay.
What does Forward Devils Lake have on hand if they were stuck with part of it?
We would end up paying it out of the growth fund. And as far as the we'll say going under and the amount that's guaranteed, it wouldn't be one big lump sum. It would be in probably installments.
3 to 5 years.
Right, right,
It's
but
slow
I'm just
installments,
wondering, what's the growth fund? I don't look every day, but what's the growth fund have on hand?
It's
Anybody know?
about $800,000.
Okay, so that's where the
And
money would
once
come out.
again, we've got a period of time, if indeed that were to even happen, right? We've got that time frame, so the growth fund is growing as well.
Yeah.
We haven't used many dollars other than the loan guarantees that we've had through the Forward Devils Lake recommendation. Once again, it's city dollars, and their growth fund dollars are city dollars,
Right.
not Forward Devils Lake dollars. So just about everything's a recommendation to you all.
Okay.
They put a new roof on there, right?
Yes.
They did that themselves.
They
bought $1 million.
That was included in their package. I don't know if they ever did, but that was included in the package.
You know, I can't speak to the new roof. I know that a large portion of the budget did cover some repairs on the roof. But not only that, but there was a lot of fixtures that were included in. Obviously, I can't mention it, but I mean, we're talking a significant investment in that building. So what you gave for $1.5 million today, if this company's profitable, I can easily say that building's worth $4 to $5 million, depending on their EBITDA. So
I can say that 100,000 square foot building in this, any other part of the state, potentially, mainly because of workforce, it's not worth as much, would be worth double that. I mean, it's amazing. The building is what we are able to use to get people here. So it wouldn't sit empty long, I feel very strongly in saying. But we don't want it to be empty, right? We've got 40, 45 workers. The additional workers with Angstrom being seen, probably another 30. A significant number. Just as Summers is now at, Rob, do you have a number for me? Are we at 100 now out there at Summers, just under?
Just under.
Just under. They're the two primary sectors. Lone Tree Designs is another one. Eric Osmond's company, he did get primary sector status, as well as Joe Gleason's company as well, North Dakota Patrol.
Is there potential for adding more employees with this happening too, with, they're expanding a little bit?
Well,
There is
part of this request, they're asking for, they installed a wash line. So essentially what they do is they take beans out of the field, they give them one simple rinse, and those can be sold for restaurant consumption. And so they have a group down in Phoenix that is strongly considering taking those on. And unfortunately, it's pretty efficient. They got some robotics out there, which is pretty interesting if you guys have taken a tour of the plant. But we're talking maybe one, but it is addition, I guess, an addition.
Yeah. I'll make a motion, Mayor.
Motion by Commissioner Hamry to approve.
I'll second.
Second by Commissioner Hatch. Any further discussion?
So to be clear, if something goes amok, the money would come out of the growth fund with Forward Devils Lake. I mean, we're just approving what they're recommending.
That's right.
That
And
there's nothing.
It's a city's growth fund too. It's not Forward Devils Lake, so it is city dollars.
Yeah, growth, it's funded by sales tax dollars.
Correct, yeah, I know, but I just want to make that perfectly clear.
Have you met Brian?
Yes,
He's not one that gives up.
well, so did Mike Tyson. But he went down.
Okay. All right. Any further? If not, all in favor, let's do a roll call, please.
Commissioner Hash?
Aye.
Commissioner Robbins?
No.
Commissioner Pierce?
Aye.
Commissioner Hamry?
Aye.
President Mo?
Aye. Motion carries. Okay. Thank you.
Thank you, John.
Next item, second reading of ordinance 985, the order of business and the citizen comment policy.
Just the second reading of that ordinance, again, change order of business and as well as a citizen comment policy that was attached. So same recommendation as before you at the previous meeting. So any questions, we welcome any. Other than that, recommend approval.
I'll make a motion to approve.
Motion by Commissioner Robbins,
Second.
second by Commissioner Hatch. Any further discussion? All in favor, say aye.
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 Opposed, same sign. Motion carries. Pay estimate, city project 220-201, West Side Water Main. Mike.
The estimate includes work that's been completed to date. That work has been completed on 11th Street Northwest as well as 10th Street Northwest. The amount of the pay estimate is $92,350.92. Recommend approval of the pay estimate. And just for the commission's information, there'll be a couple of change orders that will be coming forward for the commission. One of those change orders will address the work completed along College Drive adjacent to US Bank. That work, really came up almost as of an emergency nature in order to get that main back in place, provide the redundancy that's required in that department or in that section for the water main, as well as to be able to provide service to that building. That's the only building that's hooked to the main in this particular case. There'll also be a change order coming for some sewer video work that we had completed in that area. There's a very old section of town. There's protruding taps, and there's a lot of calcification on some of the joints over there, and it prevented a lot of the video from occurring without doing some additional work there. So those change orders be coming forward for the commission in some future meeting. At this point, though, recommend approval of the current pay estimate.
I'll make motion to approve.
Motion by
recommendation.
Commissioner Robbins.
Aye.
Commissioner Hatch, second. Knock, knock. Okay, roll call, please.
Commissioner Ash,
Now you can say aye.
Aye.
Commissioner Robbins.
Aye.
Commissioner Pierce,
Aye.
Commissioner Hamry.
Aye.
President Mo.
Aye. Motion carried. Okay, next item, pay estimate number 4, 2022 curb, gutter, and sidewalk.
Hopefully we don't have awkward silence in this one. I was a little nervous about $92,000. If we're not gonna pay them, I don't know what we're gonna get done.
Here's a chance to come in.
So this pay estimate includes work completed to date under our curb gutter and sidewalk contract. Total due this estimate is $14,508.12 for work completed to date, as I'd mentioned. Recommend approval.
Recommendation,
I'll make motion to approve.
motion by Commissioner Robbins.
Second.
Second by Commissioner Hatch. Any further discussion? Roll call, please.
Commissioner Ash.
Aye.
Commissioner Robbins.
Aye.
Commissioner Pierce,
Aye.
Commissioner Hamry.
Aye.
President Mo.
Aye, motion carries. And the last item, public fishing pond, city partnership with Park Board. Who's here to speak to that?
Terry Wallace was the park superintendent, was supposed to be here to speak to it, but he's unable to attend the meeting tonight.
So you don't want the money.
He wants the money very badly because they're looking at opening some proposals tomorrow.
He should have been here then.
The city and the park district were approached by local groups, local angling groups in the local Lake Region sportsmen related to an urban fishing pond. And with an urban fishing pond, it's a little bit strange, right? You look at Devil's Lake, you have 150,000 acre lake and all kinds of fish in that lake. The intent behind an urban fishing pond is to provide easy access to a lot of fish in a small area. So in some particular cases, there's people that are mobility impaired, some of the local group homes, the local nursing homes, and other residents that don't have a lot of time and they don't have the mobility to access a lot of the shoreline adjacent to Devil's Lake because of riprap and other features. So the intent behind an urban fishing pond is to have a pond that is easily accessible, and you pack a lot of fish into a small area. And with a lot of fish in a small area, I think even the park superintendent himself could catch fish. And so what's being looked at in this particular case, we visited with the Game and Fish Department related to the concept of an urban fishing pond in Devil's Lake and utilizing some of the existing ponds up in Ruger Park. When the Game and Fish Department was approached related to the concept, they approved $45,000 for the work. Not only did they approve the $45,000, but they also helped us with the permitting process through the Corps of Engineers and through some of the State Historical Society folks. With city engineering, we worked to put together plans for development of the pond. And I can tell you over the course of the last, I've been here 21 years, over the course of the last 20 years, we've been working closely with the park district related to all kinds of different projects. And realistically, that partnership, to me, if you look at a park district mill and a city mill, the park district valuation is essentially the city, right? When they put a mill on, it's the city of Devils Lake in a very small area out in Lakewood. And so when they do some things, we try and partner with them to make sure that we're doing what we can to try and save city residents dollars. And so with that, the city engineering has done a lot of the projects for the park district. The improvement of the parking lots up in Ruger Park, the improvements of the parking lots over in Ruger Park, the paths, the cart paths out at the golf course, putting together the specifications for their boat access to the clubhouse, just to name a few of the projects that we've worked on with them. This is another one of those projects. If city engineering wasn't working on it, you would have to hire a consultant and pay a consultant for development of the plans and specifications. And so in this particular case, we're looking at basically taking one of the ponds up in Ruger Park, excavating that pond deeper to make sure that vegetation, if we get to our goal is like a 10 to 12 foot depth. If we get that deep, there won't be weeds for people to fish.
Will there be winter kill?
In partnership with the Game and Fish Department, in all likelihood, we don't expect the fish to survive over the winter. But their plan is to stock that pond every year.
For free?
Yeah, it's part of their system. Basically, by discussions with Randy Hiltner, with Game and Fish, they're probably going to go trap a lot of bluegill at Wood Lake and drop them off. Right? And so they won't have a lot into it, but it's a project. The Game and Fish has a goal of improving fishing for areas, and they're involved with these urban fishing ponds in other communities, and so they're partnering with us on it. They're throwing $45,000 at it. They want it to succeed as well. Last March, I think the commission was brought up to speed on this, and back then there wasn't a motion made, but the discussion about the potential for providing the $15,000 cost share to help make this go. I think the commission had given a nod to the project to say, yeah, go ahead, proceed with it. And so now this is the formal request. They're open to secure $15,000 from the city, and I believe he's looking to secure $15,000 from the county. And then they'd be in a position to, open those proposals and make an award. The goal is to have the excavation and the work completed yet this fall. Conditions are dry and we get a little frost. And we may have to talk, depending upon who gets the proposal and timeframes, we may be talking a little bit about a noise ordinance, just so that depending upon when it's happening, a contractor may want to work 24-hour operations. Because once you're in there, you put up a coffer dam, you have freezing temperatures when the equipment's moving, you want to keep it moving. It's, I don't know that it's going to disturb anybody at the cemetery, but there are some adjacent. I'm trying to use some humor here, Commissioner, so I appreciate a little bit of a laugh, Commissioner Robbins. But so I would recommend the city cost share and the $15,000.
Do we have a budget item for that, or do we have?
It's not budgeted, but we can. I'm thinking about taking it out of our infrastructure fund. So, and I would say, sorry, Commissioner.
Oh, no, I was just wondering on this. I mean, you look at the rest of our parks, maintained very well. Brent does the best he can with what he's got, but he doesn't have much help. I wish, somebody'd been here to be able to speak on that. So who does the liability fall on if we all chip into this? You got the Game and Fish, you got the park board, you got the city, the county. Some kid drowns, somebody disabled falls into the water, drowns. Where does that liability come in?
They could fall in the pond now.
Well, no, I know, but they don't
seen the
have
bridge?
a reason to go to the
Yeah.
pond. There they do.
All I can speak to is there's always risk, right? With anything, you can go up there, you can fall off the swing, or you can do something. I'm sure there's some insurance that the park district has. It is a city park. The park district owns the property, and the park district is aware of all of those dangers, and they have insurance for that, and they have a city attorney. So I can tell you that with the pond itself and development of the fishing pier and the access, we will work with the park district to try and make sure that things are meeting certain codes and standards. When you put up a fishing pier, it's meeting a certain code or standard. When you're putting up that gangway, it's meeting a certain code or standard. That doesn't mean that somebody can't get hurt, but anything that we're involved with, anything that Devin or I are putting our stamp on and our name to, I can assure you it's going to meet a certain level of standard that's a requirement.
So when we get to the pier, the parking lot and the sidewalk, you're coming back for more money then?
That would be up to the park district.
So yeah, they'll be back for more money then. I mean, didn't we just give them a 1/4% sales tax?
This is something that I think would be wonderful if we could use our
ARPA?
the forward Devil's Lake money. What do we call it?
Oh, quality of life line item.
Yeah,
transfer.
and myself, I mean,
Yeah.
like he said, we aren't going to attract a large business to Devil's Lake. So divert that money and put it in stuff like this as much as we can, just for quality of life, in my opinion.
Well, we did set that up. That quality, like, there's 350 in there.
Yeah, the commission, if you wish to take it out of that fund, you can as well. We have budgeted we have a line item budgeted in our infrastructure fund that would accommodate this to, as well, for your consideration. Where I was initially thinking about taking it out.
I'll make a motion to approve the request and let you determine where you want to.
Yeah, I would just recommend that you guys obligate the funds to the park district.
Okay, I'll make a motion to obligate the funds and let it be determined where it's coming from later.
Yeah.
Motion by Commissioner Robbins,
I'll second.
seconded by Commissioner Hatch. Any further discussion?
The plans and specifications are already complete. The assistant city engineer worked on that project and the plans were put together and already stamped. That's for the commission's information.
Any further discussion? None being, roll call, please.
Commissioner Ash?
Aye.
Commissioner Robbins?
Aye.
Commissioner Pierce? Commissioner Pierce?
Knock, knock.
Aye.
Commissioner Hamry?
Aye.
President Mo?
Aye. Motion carries. Motion to pay the list of bills as submitted.
Motion.
Motion by Commissioner Hamry,
Second.
second by Commissioner Pierce. Any discussion? Roll call, please.
Commissioner Hash?
Aye.
Commissioner Robbins?
Aye.
Commissioner Pierce?
Aye.
Commissioner Hamry?
Aye.
President Mo?
Aye. Motion carries. Miscellaneous report from the Devil's Lake Court for September. Anything else come before the commission? If not,
I apologize. I have asked Mike to do a PowerPoint presentation next meeting. So just in case you guys want to bring a bottle of water with on his
you're really
roadway
chilly.
improvement plan. Have you seen this, Rob? Do you remember? Shane, you saw it. You were part of it, weren't you?
Yeah.
The X amount of years, and I don't think if Jason's seen it, and you may have, but I just thought it'd be nice if we went over it just to show everybody what the plan is.
Okay.
And you've seen it.
Remember
the
5
capital
minutes?
improvement plan?
Yeah.
Yeah, we plan to have thorough discussions internally on our capital improvement plan and our equipment upgrade plan. We hope to discuss here November, December in the cold winter days. And
Okay.
looking forward for the next 8 years as we do those
Well, that's
8-year
probably a
increments.
good opportunity to put it all together at the same time.
So thinking,
Just as this a review, it's already in place, but just
Okay.
a FYI.
Yep. That's helpful.
That map is something the commission can be proud of. The city went many, many years without doing a lot of improvement to roadways because it was flooding and water supply. Those were the two priorities, and there wasn't a lot of money left for other infrastructure improvements. And once the flooding and once that water supply was taken care of, I think the commission's done a great job of allocating costs to infrastructure. And for city residents, really it comes down to the seat of the pants ride, right? You want to be driving your car, not avoiding potholes and having a smooth roadway. And when you look at that map, you can see the improvements that have been completed within the city and future improvements. And it's something to be proud of.
There's been a lot.
Meeting adjourned.
Minimum of a half an hour.
Paula, you better get your fishing pole so you can go fishing.